Medicare questions Q&A, Dear Marci. Dear Marci, my husband still works and I am covered by his employer's insurance. I am turning 65 years old in a few months and wondering if I should enroll in Medicare. Mariko, Sallisaw, Oklahoma. Dear Mariko, it is great that you are looking into this ahead of time and making a plan. Job-based insurance allows you to delay Medicare enrollment in many cases. There are two questions to consider. One, will I have an opportunity to enroll in Medicare Part B later without a penalty and without waiting for a specific time of year? And two, will my job-based insurance pay primary on my health care claims? In other words, before you delay enrollment, you should determine whether you will have a Part B special enrollment period, also known as SEP, and whether your job-based insurance pays primary or secondary. In most cases, you should only delay Part B if you will have an SEP and your job-based insurance is the primary payer, meaning it pays first for your medical bills and Medicare is secondary. Part B special enrollment period. Because you will be eligible for Medicare due to age, meaning you'll be 65 or older, and are covered by your spouse's job-based insurance, you will have a special enrollment period, SEP, to enroll in Part B while you have that coverage from current work up to 8 months after the coverage or the work ends, whichever is first. This means that you can enroll in Part B after your initial enrollment period, known as IEP, ends without facing a penalty and without having to wait for the general enrollment period, known as GEP. Primary or secondary job-based insurance. Next, consider whether your job-based insurance will be the primary payer. Job-based insurance is primary if it is from an employer with 20 plus employees. Medicare is secondary in this case, and some people choose not to enroll in Part B because of the additional monthly premium. Job-based insurance is secondary if it is from an employer with fewer than 20 employees. Medicare is primary in this case, and if you delay Medicare enrollment, your job-based insurance may provide little or no payment. You should enroll in Part B for coverage when you are first eligible. Note, there are different rules about the SEP and which insurance is primary if you are Medicare eligible due to disability or because you have ESRD. To find out if your job-based insurance is primary or secondary, contact your or your spouse's Human Resources Department for information about your employer's size. If you plan to delay enrollment into Part B and use the SEP later, keep records of your health insurance coverage. You will be required to submit proof of your enrollment in job-based insurance when using the SEP to enroll in Part B later. Proof of enrollment in job-based insurance includes written notice from your employer or plan, documents that show health insurance premiums paid, including W-2s, pay stubs, tax returns, and/or receipts. Also, health insurance cards with the appropriate effective date. Note, if you have insurance from an employer that is not because of current work, like COBRA or retiree insurance, there are different rules for the SEP and which insurance is primary. In summary, you should find out if your husband's insurance will be primary to Medicare. If it is primary, then you can delay Medicare enrollment if you'd like, since you would already have primary insurance from your husband's current work. I hope this helps you decide whether or not to enroll in Medicare during your initial enrollment period. Marci. We do have a second Dear Marci Q&A. Dear Marci, does Medicare cover depression screenings? I've read about how depression is more common in older adults, and I want to be sure I am not missing signs and symptoms. Sarah, Chapman, Maine. Dear Sarah, yes, Medicare Part B covers an annual depression screening. The annual depression screening includes a questionnaire that you complete yourself or with the help of your doctor. This questionnaire is designed to indicate if you are at risk or have symptoms of depression. If your results show that you may be at risk of depression, your provider will perform a thorough assessment and will refer you for follow-up mental health care if appropriate. Depression screenings should be conducted by your primary care provider, PCP, or another trusted doctor to ensure that you are correctly diagnosed and treated. In most cases, you should receive your depression screening when you have a scheduled doctor's office visit, often during your annual wellness visit. However, you can also ask your provider to screen you during a separate visit. You do not need to show signs or symptoms of depression to qualify for screening. However, the screening must take place in a primary care setting like a doctor's office. This means Medicare will not cover your screening if it takes place in an emergency room, skilled nursing facility, also known as an SNF, or hospital. If you qualify, Original Medicare covers depression screenings at 100% of the Medicare approved amount when you receive the service from a participating provider. This means you pay nothing, no deductible or co-insurance. Medicare Advantage plans are required to cover depression screenings without applying deductibles, co-payments, or co-insurance when you see an in-network provider and meet Medicare's eligibility requirements for the service. Finally, if you are having thoughts of suicide or are concerned that someone you know may be having those thoughts, in the United States, you can call the National Suicide Prevention Lifeline at 800-273-8255. TALK are the last 4 digits of that number, or go to speakingofsuicide.com/resources for a list of additional resources. Click here for a list of international resources. And remember that depression screenings are a healthy and important part of everyone's preventative care. You can learn more about Medicare's coverage of behavioral health services here. Marci.